Today, I'm going ahead of the science and making a prediction based on an extrapolation of the science. I did this a number of years ago with heart failure, and exactly as I predicted is happening now. And it's not surprising. It's kind of like if I went back into the 70s when everybody was smoking, and I said there is going to be an epidemic of lung cancer. It's just an extrapolation of the science. And so what I'm doing now here is similarly an extrapolation of the science. And what I've got here is that I had an interview last year with mothers whose children had been damaged and they were making a stand. And specifically, I'm talking about Hetisima is in this presentation, and you can find the link to the full video on my Substack. Strangely, this presentation was censored, so you can't see it anywhere else. But it was very important, and she made some important points about what happened. And she was speaking about the fact that her son had died after he had been vaccinated with an aortic dissection. And it took her almost a year and a half to 2 years of pushing to finally get the evidence that confirmed what she had suspected. It's just a point in time, but I am now going to be sharing with you more recent research. And this is what has caused me to be so sure in terms of this prediction. This paper was published on the 28th of May, 2025. Pre-proof, rare presentation of post-COVID inflammatory aortitis. Now, you have to understand that this is infection, and in the context of what happened before in Hetty's son, it was vaccination. And it fits perfectly with what I describe as the COVID storm. That's when we have a combination of the two things. Oftentimes, you can have mild initial symptoms, but underneath, there is a chronic immune process that is causing all kinds of problems. And that's the essence of what I'm talking about today. I predict that based on the trajectory of the inflammatory processes that are occurring, it's almost inevitable that we are going to see an epidemic of aortic dissection in the years to come. Now, what's the science behind that? Why would I even say that? I'm going to first give you a breakdown as to what we're talking about when we talk about the aorta and we talk about aortic dissection. Let's start with the basics of the science. Here we have an image showing the aorta. So you can see here, this is a heart up here. It pumps blood largely through the aorta, which then goes up to the brain and the arms. And then it carries a lot of blood down to the abdominal organs and then down into the legs. And it splits here. And this abdominal aorta is a very important blood vessel. If this bleeds, it is probably one of the most catastrophic medical events that can occur and requires immediate surgery. It's what we call an aortic dissection. And the aorta is here in red. What you have to understand about this artery is that it's very thick. And when you look at this image here, it shows you what it's composed of in sections. And on the inside is a very smooth lining with the endothelium. Then it has elastic in yellow around the outside. Then it has a muscle layer, then more elastic. And then this layer on the outside, which is called the adventitia. And it's supplied by certain blood vessels in order to keep it well oxygenated. You have to remember that even though there's blood on the inside, it's difficult for it to get to all the tissues in such a big artery. And so it needs blood on the outside. Now, what we have found is that this layer gets inflamed in relation to the spike protein. And this is why it can be from infection or vaccination. It's what we call aortitis. And if this gets inflamed, it damages the lining, causing it to get weaker. And potentially, because the pressures are so high in the aorta, it can then push through and cause an aneurysm. And that's the essential piece of the puzzle with regards to an aneurysm. And once it starts to tear through the lining, you can then get something looking like this. So on the left here is a normal aorta with the muscle layers, the inside lining, the blood in the middle, the elastic lining. Then what happens is that in a dissection, it tears through this lining and then starts to track down the artery. And because the pressures are so high, if it pushes all the way through, it can lead to a rupture, which is a catastrophic event. There are multiple types of dissection, and not to get too high into it, but essentially you can have different areas of the aorta dissecting. In this one here, this is the top part on the arch. In this one here is lower down beyond the arch. And in this one, it's on the arch and beyond the arch. So they have different types of dissection. All of them are very serious, and all of them require long-term monitoring to see if patients need to have surgery. And this is the crux of where we are. So my prediction is that we are going to see an epidemic of these kinds of dissections over the next 5 to 10 years. It is almost inevitable based on the science. So let's break down where the science comes from. And it's important to note, before I start that, I want to let you hear what Hetty said in relation to her son and his story in the relation to what happened after he had been vaccinated. This is his story. It was discounted at the time, and many people still discount it. But I've seen the data from the pathology slides, and I agree with their assessment. But that's just the reality of where we are today. Listen to what she said at the time.
Day when they on about 16 days, he took the COVID shot on April 20th, and on 16 days later, he died of an aortic dissection. It was sudden. I had been speaking to him the day before. We were laughing. He would call me 4 or 5 times a day anyway. So there was nothing for me and, he wasn't sick. He was actually dancing with his girlfriend the night before in celebration of a promotion she had gotten. And then on the morning of May 6th, I got the phone call that every parent dreads. I would, Hetty.
That was her story, and you can see how traumatic it was for her at that time. And that's what caused her to fight for her son and fight for an understanding as to why 16 days after he ended up with a dissection. And it now ties in to what we're seeing here in the context of infection. So here we have a case of post-COVID inflammatory aortitis. That's inflammation of the aorta. And this was highlighting that a patient who had been diagnosed with COVID-19 without respiratory symptoms, remember I'm telling you this is no longer a respiratory disease, presented with failure to thrive. They were struggling to get better. They found a rapidly progressing, penetrating aortic ulcer involving the ascending and descending aorta, as well as the infrarenal abdominal aorta. So for this to be so extensive, it suggests that the whole aorta had to be inflamed. They gave them high-dose steroids, and it showed that there was still growth and no need for surgical intervention. But it highlighted the life-threatening vascular complications of COVID-19 and the importance of early recognition and individualized treatment strategies. This is exceptionally important in the context of an environment where we have highly vaccinated populations with ongoing COVID circulation. Many people assume that you have to have severe disease in order to have the complications of what I call the spike mediated autoimmune response mechanism, COVID storm. It just needs further exposure to the spike protein from whatever source. That's why this is so serious, because COVID is continuing to circulate very highly. So someone may say, well, there is no evidence that this will cause an epidemic of aortic disease. I'm so tired of people saying these things without actually doing the research, because the research gives you the answer if you know what to look for. So here is the reality of what is happening. This was published on the 23rd of the May 10th, 2023, sorry. And it was highlighting that COVID infection may promote aortic aneurysms, and there was a new treatment that may slow its growth. Remember, we have had 2 points so far. One, the case with Hetty's son, who had inflammation of his aorta with subsequent dissection within 16 days after vaccination. We have a case of aortitis where someone had a COVID infection and then had inflammation of the aorta with weakening and dissection. And now I'm highlighting again that COVID infection can also cause inflammation of the aorta. Now, this is the bit that is really important. What they found was that participants who reported a previous COVID infection, they did not say severe COVID infection, just a previous COVID infection, were 9.7 times as likely to have rapid abdominal aortic aneurysm growth, higher growth than the average of 2.7 millimeters per year. This is, so it's 9.7 times higher after a COVID infection compared to chronic kidney disease, which is just 3.8 times, and a smoker is twice as likely. This is absolutely frightening because COVID is circulating continuously. As I warn people, when you think about what is happening, this is how the disease is now presenting. People no longer have severe COVID-19. They have mild symptoms. They may just be left with a bit of fatigue. Their blood pressure may go off a little. They may have a little bit of a cough or some breathing problems, or they have some brain fog. Then they have a stroke, a heart attack, or a dissection. This combination is inevitable because it has already occurred. This is not in the future. COVID has been circulating now for 5 years. If you are having recurring infection, the chances, if you already have an inflammatory process in the aorta, increases significantly. So for people who already have aortic disease or who are prone to it, this is almost, as I said, inevitable. Just so you don't forget, I am predicting an aortic dissection epidemic. It's important to note that this is not something that affects everybody because aortic dissection is not that common, but it's still significant enough that if the numbers were to double or treble, that would put significant health impact on the whole system. That's where people don't understand the implications of these points. They think it means everybody is suddenly going to have a dissection. No. If we had 0.1% of the population having a dissection, you may end up with 0.3 or 0.4. That's 3 to 4 times, or based on their prediction, 10 times, 9.7 times. So it will then become 1%. But suddenly, when you look at a population of 1 million people, that is a lot of people. That's where we have to be nuanced and understand it is not in your interest to listen to people who continually minimize this beast of a virus. Just because symptoms are mild doesn't mean it is not causing you damage. We have to find a way out of it, and everything is about reducing the exposure of this virus getting into the bloodstream. That's why the truth is that those with good natural immunity, or those whose natural immunity hasn't been impacted through vaccination, are in the best position to reduce systemic exposure of this virus causing inflammation. This is pretty serious stuff. And there is no way out of this, but potentially we can mitigate it. If we can identify the people who are having this problem and try and mitigate in whatever way, whether it's monitoring, whether it's immune suppression, like what happened in the case of aortitis, they used high dose steroids. Whatever it takes to be able to suppress this is absolutely critical. But this is where we are now. And the reality is that if there is no acknowledgement for the risks that can occur from any source of spike protein, we have very little chance for mitigation. As I remind you about watching this important video with regards to Hetty and Dr. Balbona, who helped to do the research, and Heather Hudson, they all were standing up because their children were negatively affected. A lot of people say the risks are small. It's okay. Don't worry too much about it. Well, what I'll do is, as I leave you at this point, I will leave you with the words from Hetty, who gives you the answer to what she thinks after having lost her son to this kind of process. Here is what she said.
Rare when it's your child. And to those people that say, well, it's for the greater good, I say, well, which one of your children are you going to be willing to give up for the team? That's what people have to think about. And you cannot just flippantly say, well, we saved lives. Give me your child. Let your child die. And then let me ask you if you still feel that way.
Powerful words. And she's right. What can you say? Let's see if we can find solutions. There's still a lot of work for medicine and science to do. All I'm doing is raising the flag. We still have to find answers and find ways to protect the population from what seems to be an inevitable epidemic. Have a good evening.